Hello again and welcome. My name is Valerie and greetings. Today I'm going to be talking about medical emergencies, specifically in Canada, and how it affects individuals, families, and society. So, medical emergencies, as we all know it, in Canada can have profound effects on individuals, families, and society. While Canada's publicly funded healthcare system, Medicare, as we know it, provides essential medical services, emergencies can still lead to financial, emotional, and social challenges. So, when we look at medical emergencies, it does have effects on in the individual, families, and society. Looking at the effects on individuals, there is the physical and mental health impact, and that is when a medical emergency causes long term physical disabilities, chronic conditions, or mental health challenges which affects a person's quality of life. Another effect would be financial strain, and that is has to do with essential healthcare being covered and expenses like medications, rehabilitations, home care, and loss of income can create financial burden for the individual. Also, there's employment challenges. So, severe medical conditions may prevent individuals from working temporarily or permanently, leading to income loss and reliance on government support. Another effect is the emotional distress on the individual because sudden health crisis can lead to stress, anxiety, and depression, particularly if recovery prolonged or uncertain. And this does not only affect the individual, it also affects the families. And the families are affected emotionally and psychologically. And they also can experience stress when family members often experience stress, anxiety, and emotional exhaustion when caring for their loved ones. There's also the financial burden that can also affect the family, which costs not when costs are not covered by Medicare, for example, private home care, transportation, medical supplies can strain family finances, and if a primary earner is affected, the entire household may struggle. Also, there is the care giving responsibilities also is another effect on the family. So family members, especially the women, in most cases, often take on unpaid caregiving roles, impacting their own employment and personal well-being. And we also have the impact on the children. When a parent or sibling experiences medical emergency, children may face emotional distress, disruptions in schooling, or even changes in family dynamics. There's a lot of stress put on the family. So medical emergencies also it does affect society. And some of these effects can be seen in the healthcare system. There is a strain that is put on the healthcare system, and we have emergency departments. The ambulance services and hospitals may become overwhelmed, particularly during public health crisis. For example, we saw that the pandemics with COVID and also the overdose period. That was well seen in Canada, at least if you remember those times. There's also economic cost, lost productivity, disability benefits, and increased healthcare spending can place financial pressure on the economy and government resources. So we also have another effect on society, which is social inequality, and that's vulnerable populations with low income, individuals, including seniors, indigenous communities, are disproportionately affected, highlighting gaps in healthcare access and social support system. So these things does affect society, and we have public policy and preparedness. So there is high rates of medical emergencies, for example, due to aging population, chronic diseases influence government policies on healthcare funding, emergency preparedness, and social support programs. So, medical emergency does take its toll on not only the individual but the families and society. So, medical emergencies in itself is impact individuals, like I said, communities, societies in complex ways. While Canada's universal healthcare system alleviates some financial burdens, yet gaps remain in areas like long-term care, prescription drug coverage, and mental health support. So, strengthening emergency response, expanding support services, and addressing health disparities are some of the ways the way we can intervene can help reduce the long-term effect on medical crisis. I hope this has been helpful. I know it's brief, but I just wanted to touch on it because sometimes we don't even think about these things. So it's a social issue. Medical emergencies does impact us as individual, families, and society. And hope this has at least been giving you an insight into what it is and how we can solve it. Thank you for listening and thank you for stopping by. Have a good day. Bye bye.